It's 5 minutes after 10 right here on Women Radio WFM 91.7. An amazing Tuesday morning to you. I hope you're feeling great and you are doing well today. You're welcome to the program Radio Doctor, your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise right here on radio on your Women Radio WFM 91.7. Radio Doctor comes to you Mondays through Fridays from 10 a.m. up to 11 a.m. My name is Rose Yusuf Kaiser, and our radio doctor for today is Dr. Colin Taboloje. He's an assistant medical director and fertility physician at St. Ives Specialist Hospital in Abeokuta. Good morning, Dr. Taboloje. How have you been? How's work going?
Good morning, Rose. I've been okay. Work has been fine. We're just taking it one day at a time. How about you? How's work been? How are you feeling? How are you generally?
I'm okay. I'm good. Thank you so much for asking. Work has been fine. And like you said, we're taking it one step at a time before we give ourselves stress that we don't know where it's coming from.
Right.
Thank you for joining us today, Dr. Bolojay. So, that's the voice of Dr. Bolojay, and he'll be consulting and advising on erectile dysfunction and infertility. Yep, they're connected. So today we'll know the connection between erectile dysfunction and infertility. Now, phone lines will be open shortly, but in the meantime, please do well to send in your text or a WhatsApp message to 070-317-56537. All right, send a WhatsApp message to 070-317-56537. That's the number to get in touch with me this morning before we get to open up the phone lines for you to call in with your questions, all right, or thoughts, or anything that comes to mind as regards erectile dysfunction and infertility. Now, do well to join the conversation by sending your contributions to our social media platforms on Facebook, Instagram, X, and YouTube at WFM917, or log on to our website www.wfm917.com. You get to listen live from any parts of the world. All right, from that website. Okay, so this is Women Radio WFM 91.7, and it's about 8 minutes after 10 on the side of the radio. My name is Rose Yusuf Kaiser, and we have Dr. Aboloje with us this morning, and he's consulting and advising on erectile dysfunction and infertility. So let's head on straight to the discussion of the day. Now, Dr. Aboloje, as a fertility physician, all right, in your practice, I know this case has pretty much be coming up to you, frequently. So kindly take us through what this means, that is erectile dysfunction, and, just give us an overview of what this actually means for a man and how it also gets to affect a woman, and infertility in general.
Okay. Thank you for that question. So, basically, let me give some background information before I dive into the meat of the discourse. So basically, before a woman can get pregnant, she has to have intercourse with her partner, with her husband or partner, as the case might be. And for her to actually get pregnant, she has to, of course, the egg of the woman and the sperm cells of the man must unite. So there has to be fertilization of our eggs. Okay, for an embryo to be formed that will result in the pregnancy.
Yeah.
But for some persons, okay, there is a missing link. More like there is the absence of one of these components, which is the sperm. And it is not that there is a problem in the man. It is just that he is unable to achieve erection to expel that sperm, okay, that is produced normally in his testes. So, the woman, if the man is unable to have intercourse with his wife on her ovulation day, or maybe even a day before the ovulation, because the sperm has the capacity to stay alive for at least 3 days inside of the woman, okay, of course, pregnancy will not happen. So that is the reason why I thought this topic would become very beneficial to the general audience. So we know that before a man can ejaculate, he must obtain or have achieved erection. Without erection, a man cannot ejaculate. The flaccid penis of the man cannot expel sperms. It is only when the sperm is erect That is when all the stimulatory responses and all of that can, of course, result in that ejaculatory function. Okay, so the penis of man is not only used to expel urine during, when he wants to urinate, so to say, but
Yeah.
also to expel the sperm cells of the man into the woman during intercourse. Okay, and we call that ejaculation, actually. So erection, now, for people who don't know what it is, erection is simply the hardening of the penis of the man. Okay, that occurs when the penis gets filled up with blood. The penis of the man is a male reproductive organ that helps to expel urine and also semen during intercourse, as the case might be, or urine during ejaculation. So if the penis does not get filled up with blood, it will not get erect. And if the man does not achieve erection, the man will not ejaculate. If the man does not ejaculate sperms, okay, or semen, as the case might be, containing sperm, semen containing sperm, of course, he won't be able to impregnate his wife. Now, this is now the linkage between having erection problems with infertility. Because we know we have listed like a couple of causes of infertility, in the couple. But for some people, their problem is that the spouse, which is the husband now, is the cause. Because he has problem achieving erection, either by some reason of maybe some psychogenic cause, or that's about maybe his psychology, maybe he's going through depression, anxiety, and some other, just general life issues, especially in this Tinubu economy, So that is one cause. While for others, it could be maybe he has an organic, we call it organic cause, which could be as a result of maybe one bodily disorder or the other, maybe diabetes, hypertension, and the rest. Yes, we're going to still delve into that aspect, but I just wanted to just give us, I'm trying to just throw at us the perspective, the angle from which I'm taking this discourse. So, with that said, for a man to achieve erection, it involves a complex process of interaction between the brain, the spinal cord, the blood vessels, and also the penis itself. You can see it is easy for a man to just have visual stimuli, and you're seeing something that is appeasing sexually to you, and then you just achieve erection. But there are complex event that takes place inside of the body. In fact, when you tell somebody that erection starts from stimulus being driven from the brain, somebody will be like, well, okay, what do you mean? What has the penis got to do with the brain? So, truthfully, the brain has a role to play. Even the spinal cord has a role to play. And the vessels, because if the penis does not fill with blood, it will not get hard. And as such, the erection will not happen. Okay, so now we found out that some men have what we call erectile dysfunction. Now, erectile dysfunction is the inability of a man to maintain, to achieve or even maintain. Because for some people, they can achieve erection, but after like 1 minute, it is down. It becomes flat again, becomes soft again. So that is also erectile dysfunction. It is not just about the total absence of the erection, but also the inability to maintain it. You have to maintain it throughout the entire course of the intercourse, down to after ejaculation, before the erection becomes flaccid again. But if you achieve erection, initiate intercourse, you start the process, and then within 30 seconds or so, without ejaculating, of course, the erection disappears. Then, of course, that is still erectile dysfunction. So, erectile dysfunction is the inability of a man to achieve or maintain an erect penis long enough to complete, sexual activity, to complete sexual intercourse. And now, you have to know that it is not all, anytime a man experiences, erectile, delay, let me call it that. Okay, that is when it is diagnosed as erectile dysfunction. Even healthy men that do not have any problems, okay, they could maybe be due to certain life, issues here and there, maybe some disturbing news from your relative, or even maybe from work and all, could actually affect your ability to engage in sexual activity, maybe because you won't be able to, develop an erection at that point. So basically, this condition has to persist for at least a minimum period of 3 months for you to now have erectile dysfunction, that the man is actually experiencing erectile dysfunction. So the time also matters. Now, it is important that we know that there are some risk factors, of course, that would result in that would, predispose people to having this erectile dysfunction. Never tires me to, of course, talk about these risk factors like age. So it is said that about 14% of men between the ages of 40 and 49 will experience erectile dysfunction. And of course, as men age, as they progress in age, so also does the number climb in the proportion of men experiencing erectile dysfunction. We see that around 25% of men between the ages of 50 and 59 will experience erectile dysfunction, and even a very high figure of around 50% of men between 60 and 69, of course, will experience erectile dysfunction. This is largely maybe because of the deficiency or the reduction in the production of the testosterone as a man ages, and as such, this is also part of the reason why erectile dysfunction will happen. But also because age itself will predispose men to having certain conditions, diabetes, hypertension, and the rest. And all of these things these conditions that I just made mention of, can predispose a man to having erectile dysfunction. Smoking can also affect a man's ability to achieve erection. Smoking, alcohol use, recreational drug use can also affect a man. And of course, a large BMI, body mass index, especially having a BMI above 25, okay, can predispose a man. You find men that are on the obese side, that being obese will predispose a man to having erectile dysfunction. There are some causes, different causes. Generally, we usually will group them into about 4 causes. It could be neurogenic, when it is caused by maybe a problem, from the brain, or maybe affecting the nervous system of the man, maybe men having stroke, things like this, or maybe having one spinal trauma, one accident that has resulted in them becoming quadriplegic or, paraplegic, as the case might be, so all of these things can cause, erectile dysfunction. Then, of course, it could also be psychogenic. Usually, we don't allow that aspect of the psyche of the man, that's ability, more like the libido and all of that. So basically, we've seen that people going through anxiety, depression for one reason or the other, maybe marital conflicts even can result in, an aversion for sex, and of aversion for sex will arise from maybe resentment of their partners, and all of that, and this can result, in the man not being able to achieve erection. I've said it here on this radio channel that I've seen a man who said, "I can't have an erection for my wife, but I'm sorry, men, for those of us listening, I'm sorry if I'm just saying, but really, the man said, I can't have an erection for my wife, but I can for my, girlfriend, out there. So I don't know, doc, what is going on?" Of course, I knew it was quite psychogenic, because it doesn't seem that there's a problem. If he's able to achieve erection for one person and not achieve for another, then that's quite psychogenic. And then for some other persons, it could actually be what we call vascular, meaning it's a problem with the vessels. Like I said earlier, for a man to achieve erection, blood must flow into the penis. Blood has to flow into the penis. There's what we call the corpus cavernosum, the cavernosi in this case, because there are 2, and then of course you have the corpus punctum. So blood has to flow into that corpus cavernosum and cavernosi, as case may be, because there are 2. Like I said, usually it's a Latin word for this structure of the penis. So basically, blood has to flow in there for the erection to happen. So when the blood flows in, it becomes hard. When the blood flows out after ejaculation or after the cessation of the stimuli, of course, the penis will become flat again. And lastly, it could be caused by, hormonal problems. Usually for some men, they could have conditions that predispose them to having testosterone reduction. Testosterone is the male hormone that is produced by the Leydig cells of the testes. Okay, so this testosterone also has a function to play in men achieving erection. I think I'll stop for now. I'll stop there for now. So I'll let you ask some more questions.
Right. Thank you, Dr. Boloje, for taking us through, the nitty-gritty as regards to erectile dysfunction and infertility. Okay, so this is a time that you get to call in. Phone lines open as it is. So do well to call in with the number 07000 917 917. Send a text or a WhatsApp message to 070 317 56537. 070 317 56537. 565. All right. So that's the number to send in a text or a WhatsApp message. The number to call in is 07000 Feel free to call in. Let's get to hear from you. You have questions, you have concerns as regards erectile dysfunction. Please call in. The doctor is here to talk to you about all of your concerns. There's more. This is Radio Doctor on Women Radio, which is your free health consultation program where real doctors advise real people. My name is Rose Yusuf Kaiser, and we have Dr. Colin Sabology, an assistant medical director at and fertility physician at St. Ives Specialist Hospital in Abeokuta. Okay, and today he's consulting and advising on erectile dysfunction and infertility. Now, he's been able to tell us what we need to know as regards to erectile dysfunctions, some of the reasons why a man could actually have this, and why sometimes at the end of the day, doctor. So, are we saying that most of this has to do with the mind, the state of the mind, maybe at that particular moment? When the man is about to have intercourse or for that, because I feel like that's where a lot of it comes from. So if your mind is not in a good place, or if your psychological mind is not in one place, or is not okay at all, if you're not okay mentally, then you might not just be able to achieve a good sexual intercourse because of this erectile dysfunction. So my question is, how connected is our minds to this? Because sometimes I think it has to actually maybe start from there.
Okay. So now, basically, the mind is largely connected to achieving erection. So for erection to happen, it really begins with mental stimulation.
Yeah.
Okay, mental stimulation or psychological, either psychogenic or psychological stimulation, as the case may be. So what it simply means is that men would achieve erection, usually originating from audio visual stimuli or fantasy. So you see a beautiful lady, well, it's quite sexually appealing, having all the endowment and all of that. Basically, well, I'm just trying to be very, very down to earth. I mean, for a man, you start thinking so many things. This is where men would say, you've undressed me in your mind, or something like that. You understand?
Yeah.
So yes, so that is as trigger as that statement sounds. That is what it really. That is where it more like starts from. So you see this lady, she's quite sexually appealing to you,
All
and
right,
that already
let me just
primes your body, so to say. That is, yeah.
Oh, I was about to pick a call, but go
yeah,
ahead.
So that. Oh, okay.
Yeah,
okay. So that already primes you. So that's more like the mental stimulation that is needed. Fantasies and just even sometimes for memories. For some people, you hear some people say, if I something like that.
Okay,
so
doctor,
basically, all of these things can bring to mind. Okay.
Hello, good morning.
All right. Were you about to pick?
Yes.
Okay.
Good morning. My name is Jacob.
Jacob. All right. Where's Jacob calling me from?
From Lagos.
From Lagos. All right, Jacob, go ahead. Let's hear
you. Yeah, the issue I have is, although I do have erection, but after meeting my wife for the first round, it just go down, and I can't continue any further. So I want to ask the doctor, what would be the factor responsible for that?
Okay. All right. Thank you, Jacob, for calling.
Okay.
All right. Go ahead, doctor.
Okay, so basically to Mr. Jacob, now the good news is that you were able to achieve erection in the very first place, and in fact, you were able to complete more like one cycle of sexual activity. So you are not necessarily in the category of men that are experiencing erectile dysfunction. It is a normal thing to have a period of flaccidity of the penis. Okay, after the sexual intercourse, and it will still take again the more like we call it tactile stimulation, touching of the penis and all of this for you to, and even foreplay, for you to achieve another erection. For some people, it can be very, very spontaneous, maybe because of youthfulness and all of that. While for other people, especially with respect to age, they do not have this capacity for it to just spring up and erect in the next round. So you might need some extra effort, which now in this case we talk about the foreplay. I'm pretty sure if we're to compare with when you were way younger, I'm not so sure of what your age is currently, but if we're to compare when you're way younger, you most likely be like a stallion, where after one round you can go 7 rounds and the thing keeps on coming back up, coming back up. But you have to know that after every sexual activity, it takes a while before your penis erects again for the next round. And for some people, like I said, it may not be spontaneous. It might require some extra effort by your spouse, your partner, engaging in foreplay with you, doing some tactile stimulation, touching you here and there. Okay, so that is one. Another thing could be, maybe your lifestyle. Even for some people, they take alcohol, smoke cigarettes, engage in the use of certain medications that they are not supposed to use, maybe recreational drug use and all of these things. So sometimes your lifestyle also plays a role in how quick it will be for you to achieve an erection. So if you're somebody that actually engage in sedentary lifestyle, you go to the office, you don't engage in any physical activities. See, blood flow to specific organs in fact, to all the organs of your body is vital for sustenance of their function, and of course for effectiveness and how optimal they would function. So you have to also know that can also be a factor. Again, we talked about BMI, your body size. If you are having a BMI that is already above the normal, which is above 25, this will also still predispose your body to having some hormonal problems. One way it might be subtle, and this subtlety can express itself in what you're just experiencing right now. Okay, so these are some of these things. So that's why we always advise men, generally, besides having a good job, and engage in, exercises, avoid taking alcohol, check yourself regularly just to be sure you're not about to develop one condition or the other. In Nigeria, a lot of people will be having because of our diet, a lot of people might be having a lot of cholesterol problems here and there. And this in itself, while for some people they might still be taking it as child's play. Okay, it can go a long way to cause problems, heart problems, and this will of course affect the way your body receives blood, the way your penis receives blood, and as such would affect your ability to achieve erection over and over and over again, especially after one sexual activity. So I mean, there's still good news for you, sir. I would just advise you engage in lifestyle modifications, exercises, control your diet, avoid alcohol, smoking, if at all you do, and all of that. And trust me, I believe you would be able to conquer that.
Okay, thank you so much, Dr. Abolaje. Let's head on to another call. Hello, good morning. Hello, good morning. I can hear you. Can you hear me? Uh-oh. All right, you want to call me back? 07000 917 Send a text or a WhatsApp message 070 317 56537. That is a number to get in touch with me this morning. If for any reason you can't get me through our phone lines, please send a WhatsApp message to 070 317 56537. Number to call once again is 070 317 07000 917 917. This is 28 minutes after 10 on Women Radio WFM 91.7. And this is the program Radio Doctor, your free health consultation program where real doctors advise real people. All right, Radio Doctor comes to you Mondays through Fridays from 10 a.m. to about 11 a.m. Today we have Dr. Collins Aboloje, an assistant medical director and fertility physician at St. Ives Specialist Hospital in Abeokuta, and we are talking about we are looking at some of the causes of erectile dysfunction, and infertility. So yes, we know that we've been talking a lot about infertility. We talked about different cases from the women. Now we're looking at some of the cases puts a lot of families in the infertility. Good morning. Are you there? Okay, do you want to call me back on 07000 917 917? That is a number to call this morning. All right, doctor. So you've actually talked about the psychological impact of this, because I mean it's all in the mind, and like you say, sometimes it's what your eye sees that your mind gets to work on, and then it actually sends the message down and for all of the acts to happen. So aside all of this, now is that now how common because at the end of the day, we want to understand this better. Now, as a fertility physician, how common is this case, among a lot of among couples in Nigeria? How often do you get to have this case come to you, and how often does this actually result to infertility for most couples?
Okay, well, in all fairness, it is not all the times that it results in infertility.
Okay.
Truthfully, there are some men who, they occasionally have erection and they're able to ejaculate, and their sperms. Because now the problem now in this case and how it affects fertility or is that the man is not having intercourse. They are not having intercourse. You find couples, they come into the hospital and they are like, well, the last time they had intercourse was like maybe 6 months ago or 3 months ago. Because then at that point, the wife picks it up and says, he doesn't have erection. So that's the problem. Sometimes men try to always hide behind, our ego to achieve erection. So because of this has resulted in like a low self-esteem, and the consequence of that is an aversion for the sexual activity itself. So basically, we've seen like I said earlier, it doesn't always result in infertility. For some men, they have a condition that will cause them to have not only erectile dysfunction, but to have sperm problems. Okay, now these are two different ball games entirely. A man might have erectile dysfunction but have normal sperm. Yes, the sperm, the count, the motility, all will still be fine. It's just that he has not been having intercourse. That's why they are not getting pregnant. Okay, so we've seen that at least in most patients that I've seen that are experiencing this, usually the men are always in their, largely always in their mid-50s and above. So basically, what we have come to see is that about 20% there, about 20-25% of couples are experiencing this. In the clinics, when they come in, taking a statistic, you see that around 20-25% of couples are actually experiencing one form of erectile dysfunction. As a matter of fact, sometimes when they come into the hospital and they tell me that, and the man is saying I'm diabetic, hypertensive, the next question that I would ask is, do you have erectile dysfunction? Because for some men, they will conceal it from you. So you want to ask it of them. So, and I ask, and then the answer is almost always yes, because these conditions will predispose them. So the moment you see that the man already has some associated morbidity, diabetes and the rest, the next natural thing that will follow is that this man is definitely one way or the other going to be experiencing, erectile dysfunction, and this is also part of the problem. Okay, so that is what we've come to see, in the at the clinics and basically general observation.
Okay. All right. Thank you very much, Dr. Boloji. This is Women Radio WFM 91.7. All right, Dr. Boloji, now we've talked about, what erectile dysfunction is and, some of the root causes of erectile dysfunction as regards, infertility. Now, let's look at, other factors that might actually cause this. And then from here, we look at the diagnosis and we get to look at the treatment also. So let's start with some common factors that we might not even know around us that get to contribute to erectile dysfunction, and we are ignorant to this. And we have men who are suffering from this without knowing that they're actually involved in some everyday activity that actually causes this.
Well, there is really not so much of activities that will result in this, but rather I would start off from the psychological aspect of things. So basically, if you're engaging in a job and you're not, maybe for some reason you're not having job satisfaction, you're always stressed from work and all of that, chances are excellent that you definitely experience erectile dysfunction. So basically, this now still boils down to the psychological aspect of this discussion. So the stress and tensions generally, either from home, from work, from your general everyday, the way you just go through life on a daily basis, generally stress and tension, through that means can of course affect a man, make him predispose him to having erectile dysfunction. Of course, anxiety. Now, for the young chaps, especially for men who are about the fear of impregnating their girlfriend before marriage and all of these things. Sometimes, really trivial as that sounds, yes, the fear of pregnancy in a man can cause you to have an aversion for sex. By having erectile. It's just psychogenic. It's just by the mind game or something. So anxiety and depressions, and like I said earlier, marital conflict. Of course, course, these are things people experience on a daily basis. Marital conflict, you find couples, they disagree about one thing, and before you know it escalates to something else, and then, of course, the man is, it's unable to achieve intercourse. Even when maybe they have resolved that problem, he could still be ruminating on the thing one way or the other, and as such, he would have an aversion for sex because he won't have erectile, he will be experiencing erectile dysfunction. And of course, for other people who have maybe conditions, diabetes, hypertension, other forms of cardiovascular disease and the rest, these conditions can predispose them to having erectile dysfunction. For some people, we've seen that they have what we call familial dyslipidemia or familial hypercholesterolemia. Now, this is like they have this family predisposition to having, high levels of cholesterol or maybe some alterations of the general lipid profile. And as such, this can cause poor blood flow to their penis generally. I'm just giving the mechanism now. So sometimes it could also be familial, but this is now, familial doesn't mean that the lineage, they all have erectile dysfunction. No. It simply means that they have a condition that predisposes them to having erectile dysfunction. For some people, it could even be the drugs. They use certain drugs. People who take alcohol, engage in all these illegal drugs, cocaine, engine, things like this can, of course, predispose them to having erectile dysfunction. And again, for some people, maybe due to trauma or maybe some accident that they had resulting in spinal cord damage and all, can, of course. So now, having engaging in certain occupation like drivers and the rest, these are people that will most likely, encounter very terrible, road traffic accidents, and that will predispose them to having problems either with spinal cord. Things like this can, of course, cause them to, start having, erectile dysfunction. So basically, this is also a risk factor of the job. And now, for some people who had cancer, maybe due to the treatment of the cancer, it's especially cancer of the prostate gland. Due to treatment of the cancer, sometimes there could be an inevitable, or unavoidable nerve damage, and this, in the long run, will result in erectile dysfunction. For some other people, it could be testosterone deficit, where maybe for some reason, due to their maybe high levels of prolactin, or maybe like we said, talking about their BMI being on the higher side, that will of course predispose them to having hormonal imbalances. This can of course cause erectile dysfunction. Now, without wasting much time, generally, to talk about the diagnosis of this condition, we usually would engage sometimes you have to employ a holistic approach in diagnosing this condition because it touches different specialty. Like I said earlier, now erection starts from mind, mental stimulation, and also it means that the brain has a role to play. So sometimes you might need a neurologist, okay? You might even need a psychologist. If it is psychogenic, now in this case, maybe because of problems at home, so you might need more like a therapist to go to therapy. Okay, for some other people, their own therapy will be like sex therapy. Okay, that's sex therapy where they go to see a sex therapist who more like tells them about sensory focusing, how to be aroused sexually, just giving them tips and tricks on how to, go through all of this. So basically, some of these inputs will be needed in diagnosing erectile dysfunction. And of course, the urologist has a role to play, of course, and even an endocrinologist, because like we said, there are so many causes of this, would have to also come into the to diagnose this condition. Of course, we also want to use blood investigations like the hormone profile, just a regular hormone profile, checking their hormone levels, FSH, LH, prolactin, and even testosterone level. That also can rule out cause of this erectile dysfunction. And then for some people, you might need to, of course, monitor their nocturnal erections. There are different types of erections generally. There is what we call the reflexogenic erection, which is the one that gets according, when you are tactilely stimulated, when you are through touch, through touch, foreplay, you are expected to achieve erection. So that is reflexogenic. For some of that, so basically for these people, and then I was about talking about the types of erection, just to throw that in quickly. Then there's what we call the nocturnal erection. Okay. You find that for they sleep over sometimes. You see that maybe your boyfriend or your husband having an erection. It's a normal thing. Men are supposed to have at least 3 to 5 erections every night, which would span a period of 30 minutes. That's why it is that some men, when they wake up, they are erect not because there's urine in their bladder that they want to pee. No, it is just like, part of this, all these nocturnal and morning erections that are part of that they are signs of, the man being healthy reproductively, so to say. So basically, it is said that what not a reliable diagnostic modality. Of course, it still plays that a role that it plays. Because if you see that your man does not have nocturnal erections, even in the morning itself, nothing, it things do not add up that way. So basically, it could be, emphasis on could be a sign that there is a. Then, of course, there are other ways of also to measure the nerve conduction in the penis. We call it penile biotensiometry. Okay, these are just grammar. It's just meant to check, the nerve conduction of the penis through vibrations and the rest. Okay, so now to jump quickly to the treatment for time's sake. So basically, like I said, it involves even various specialists. First off, you want to start first, psychological therapy. Okay, so you have to see a therapist to manage maybe anxiety, sexual behaviors and attitudes. Like I said, all these sexual behaviors and the attitude towards sex and all of that, this could be, of course, engaged by sex therapists. Okay, and again, some people need to be sexually educated again, so that you have to know that sex is not something that is like or two. You don't just carry the woman, turn her and start. It takes steps. Foreplay, kissing, touching, all of these tactile stimulus have to be engaged for erection to happen. So you have to, so for some people, like I said, it has to be maybe more like a reorientation of how sex is supposed to be for them. So that is the work of a sex therapist and the rest. And then for some people, they might need to engage, relaxation techniques, and all of these can be, advised, can be advised to them. It can be an advice to them by the psychological therapist, as case might be. Now, for others, they might require drugs. Now, the commonest drugs out there are the Viagra, tadalafils, tenafils, Cialis, and the rest. Okay, these drugs are actually meant to increase blood flow to the penis, because truthfully, when men have tried all the psychological aspects of things, try to become more relaxed, disengage from stressful activities and all, and they are still not getting the erection, of course, they might need to resort to the use of medications. Medications can come in the form of tablets or injectables, or using injections. Sometimes for men, it can even go to the extent of even having to inject drugs like prostaglandins into their penis to achieve erection. Yes, it can be that bad. Okay, oh yes, it's not just all about the Viagra. No, that is not the only trick out there to achieve erection. Of course, there could be injectables. So basically, they might need to engage all of this. So, but these sometimes are just what we call emergency kind of treatment, so to say, just to be able to achieve it. It doesn't really mind. It doesn't give you that lasting, solution. For some others, they might need to replace their testosterone levels. Very common having low testosterone levels. Maybe as a result of age and all. They might need to, of course, replace testosterone, and usually the effect will take up, after maybe four weeks. That is like after a month or so. They could start having the effect, And now it is important that I stated here that men who have hypertension should not take, should not be using Viagra. The reason is because it could cause problems for them, flushes and the rest, even faintings and dizziness. So usually we would advise that they do not take it. But for some other people, well, they could still take if their blood pressure is under control, and if they are not using other medications to also reduce the blood pressure. So these are some of the tricks that I also present in there. But generally, we advise that men with hypertension do not use this sildenafil, Viagra, and the rest. And of course, there are some devices, implants for men who will be having conditions that have not been solved by the use of psychological therapy or medications, as case might be. They might resort to using what we call penile pumps. There are pumps that are attached, where they are devices, where you have to apply vacuum pressure or so, to make the penis to become erect. Some other people might need to have surgery done to improve the blood supply to their penis. Many men who have conditions. Lastly, you could have what we call penile implants. Yes, there are some things called penile implants that are inserted into the penis that when tweaked, maybe, and usually they would have a control. Control will be in the scrotum. So the man, there's a way they tweak it, more like turns it on or something, and then of course the erection will come up. And when they are done having intercourse, of course, the tweak the thing again, they press it again, and then the thing becomes flaccid. The penis becomes flaccid. So they are done by the urologist. And lastly, they could use ultrasound waves to try to stimulate, the blood flow to the penis. So, and this can become like a solution for men. And I think I have to also add this, okay? For men who maybe find it difficult now, and maybe they are also desirous of having a child, of course, they can try to have IVF or IUI procedure done. And how is this going to be done for them? Because truthfully, for IVF or IUI to be done, there has to be egg, there has to be sperm. Mm-hmm. So how do we get the sperm from the man? We have to do what we call PESA. There's something called the PESA. That is it's like using a syringe to aspirate sperms directly from the testes of the man. Okay, and for some other people, you might need to do biopsy to get sperms from them. Especially because truth is, besides just having intercourse for sexual enjoyment and all, of course, the next is for procreation. Yeah. So if there are desires of procreating, then of course we'll need to get sperms. And if the man is unable to achieve erection through drug, through injections, through all these implants and everything, then why not we get it directly from the sperm testis? Because like I said earlier, a man can have erectile dysfunction and still be fertile. Erectile dysfunction does not result in infertility of the man. Okay, it's just that the means by which he can be able to impregnate his wife is defeated because he's unable to achieve erection. So we can still get sperms directly from the testes. Lastly, there are also some natural remedies that men can also engage using of ginseng, wheat, oats, just sesame seeds in their diet. These are more like dietary modifications and dietary recommendations. Using cinnamon and nutmeg. Usually cinnamon and nutmeg are very notorious to have aphrodisiac properties. So basically they put you in the mood, all the, just the same way some people have attributed this same function to tiger nut and the rest. So basically cinnamon, nutmeg, even tomatoes. You can imagine. In fact, when I was doing the research for this, I never even knew tomato was also part of it. I was surprised to see tomatoes in there. So yes, so basically ginseng, wheat, oats, sesame seeds, cinnamon, nutmeg, and tomatoes can also help as part of the treatment for this. Yeah.
Okay.
Thank you.
All right, tomatoes. Okay, that's interesting. That's really interesting. Okay, thank you so much, Dr. Abuluji. This is Women Radio WFM 91.7, and it's 12 minutes to 11 right here on Women Radio. And this is the program Radio Doctor. Please feel free to call in with the number 07000 917 917. Send me a text or a WhatsApp message to 070 317 56537. That is a number to get in touch with us this morning. Just get to hear your thoughts, your questions, and your concerns as regards erectile dysfunction and infertility. Now, we've actually talked a lot about this, and the doctor has really taken us through what this means and what it could actually cause for both the men and the women. Hello, good morning. Okay, we lost that call. Do want to call me back on 07000 917 917. Send me a text or a WhatsApp message to 070 317 56537. Let's get to hear from you before we call it a day on the program this morning. All right, doctor. So, does this have anything to do with age, erectile dysfunction? Does it have anything to do with the age of the man? Okay, before then, let's try this call again. Hello, good morning.
Good morning.
Hi, good morning. What's your name? Where are you calling from?
It's Mali, and my name. Please, I want to ask the doctor whether this restriction is has to do with the age.
Oh, okay. Okay. All right. Thank you very much for calling. That was almost the question the doctor. So, does it have anything to do with the age, a man's age?
Oh yes. So basically, age has a lot of role to play, in predisposing a man to have erectile dysfunction. Because, like we've seen, that about 50% of men within the ages of 60 and 69, would experience this. Usually at that age, this is actually coming off the fact that from the ages of 45, the testosterone level of the man starts to also drop. Okay, for some people, this will be compounded by now having, some other comorbidities like diabetes, hypertension, which of course is now becoming really a lot more prevalent because a lot of people are not really engaging much in exercise. While it is being, this is big, whilst the younger people tend to, of course, engage in, people who are, of course, advancing in age, it don't really do that much. So, and as such, the blood flow generally to the lower aspects, to the genitals and all of that would reduce. So this is how age, now affects through hormonal mechanism and of course through blood flow generally. Because even as a man ages, the arteries become stiffer. So basically, they be having conditions like hypercholesteremia or dyslipidemia. And of course, this would also reduce the amount of like this, and these now will now express itself as erectile dysfunction. So age has a lot of role to play. First off, even, having up to 49-50% of people in that age demography, of course, that speaks volume. So it is safe to say if you see a 60-year-old man, the man is telling you that he doesn't really achieve erection. The way you look at it, the way you compare it to a young chap, maybe somebody 35, even somebody in his 40s, just 40, just on the dot there, it's quite different. And the approach will be quite different because what you'll be telling to the 60 or 65-year-old man, you be saying, Baba, well, you don't want to be engaging in this so much because most likely by reason of your age, you'll be predisposed to having other conditions, even, heart conditions, by reason of age generally. So, one way or the other, sex is not going to be priority for people of that age demography, 65, 70s, so basically it is more prevalent in those people. So age plays a role.
Okay.
Yes.
All right. Thank you, Doctor. Our time is fast spent. So let's just hear from this caller. Hello. Good morning. Okay. The caller's gone off. So, Doctor, just wrap all of this up for us. What would you want us to take home from today's discussion so far? What's that important thing you want us to take home for men and as it relates to women too?
Okay, so now basically, I think my advice to men is that as soon as you start experiencing erectile dysfunction, I think it is important you open up to your partner. Communication is key. Sometimes it's not like you are not an island. You'll not be able to tackle this alone by yourself. Sometimes, like we said, like the example of one of the callers who said, of course, after the first intercourse, direction the next, I find it a little bit difficult to achieve for the next. So, the woman would know what to do. Through that communication, you'll be able to, put heads together and decide, okay, maybe after our first intercourse, maybe we have to engage in more foreplay first, not talking about the action. Let's have foreplay. At least the thing will come up because truly that is where sex starts from, that foreplay. Not just about the main action. The foreplay is the part of it. So that is one, communication. So be open to your wife. For some men, of course, because of their ego, they are able to hide behind other problems. Maybe they can just stir up a quarrel and then that diverts that discussion of sex, at that particular moment. So I think it is important. If you're having sex erectile dysfunction, tell your wife, let her know, so that she might even be the one to motivate you to see a specialist, see a physician about it, and get prompt help. So because your inefficiency or inability to achieve erection would, of course, cause a delay or a prolongation of the time it takes for your wife to. Yes, especially if you are people that are desirous of having children, then of course, if you are unable to achieve erection, your wife cannot get pregnant. And trust me, that's as simple as this is. It will bring a lot of emotional turmoil, emotional problems, and could even result in the dissolution of marriages. So it is very important if you're having this hide behind, I'm a man, no, I can't let my wife know because, before we're in Nigeria, things happen. I don't want to have to state the obvious on radio. But so, it's important you let her know, communication, and so that, and you can receive prompt help and resolve this so that you can be able to complete your family, because this is the problem of a lot of people. They've been enjoying it for years, and as at the time they decided to seek intervention in the hospital, most likely the man is already in his mid-60s and the woman is still desirous of a child. They've been trying, they've not had, and then when you're even doing the PESA or so, you're seeing that maybe the man said doesn't even have sperms anymore. because truthfully, age will still set in that white, to affect sperm quantity, quality, and all, whether we like it or not.
No.
So I just thought to state this on there. Yeah.
Okay. All right. Thank you so much, Doctor, for talking to us today on erectile dysfunction and infertility. Thank you so much, Doctor.
Thank you for having me once again.
All right. Do have a great day and enjoy the rest of the week.
All right. You too.
Thank you. So that's it from us here on Women Radio, WFM on WFM 91.7. A very big thank you to our radio doctor for today, Dr. Collins Aboloje, an assistant medical director and fertility physician at St. Ives Specialist Hospital in Abeokuta. Thank you all who tuned in to listen, and for those who called in also, we appreciate each and every one of your thoughts and your questions this morning. Radio Doctor on Women Radio, WFM 91.7 is Nigeria's first free consultation specialized radio health program that comes to you Mondays through Fridays from 10 to 11 a.m. Do well to join us again tomorrow from 10 a.m. for the program Radio Doctor. Thanks to the producer of the program, Aisha Sani, and the executive producer, Tom Okewale Shonaya. My name is Rose Yusuf Kaiser. Good morning.
To sponsor this program, call the number 0816 480 7613.
Mr. Johnson.